Last thing I remember really is showing up on scene, turning around, grabbing a hose bundle on the engine, turning around and reading smoke. We call it reading smoke, just seeing the conditions we're about to enter. And then that's it. So what I've been told is we went in and put the fire out in what we call the overhaul phase, which is basically looking to see if it extended anywhere, and if it's fully out, I began acting different, lost all my skin color really, and walked out to the front yard and took a knee, which is something we don't do, and leaned up on a trash can, and one of my captains recognized that as being different and came over and looked at me, and he said it was just altered, talking in circles. Took me over to the engine and put an non-rebreather on me, and I got more and more progressively altered to the point where I went unconscious and stopped breathing. And they checked the pulse and I had no pulse. So basically suffered cardiac arrest.
I got a phone call and it was my sister, and my sister had a tone in her voice that I had never heard before, and she said, "I'm not messing with you. Ryan coded at work." And so I immediately said, "What are you talking about?" And I started screaming, and she said, I don't have any more details for you, but you need to get here. He's being transported to the hospital right now. And I went running, again, 9 months pregnant, down the hallway, down the stairs, and then we roll into the ambulance bay, and I pulled into this just overwhelming view of fire trucks and police cars. So it got really, really real. I would say I was probably in a state of shock on the way up in the car, and then when I pulled in and I saw all of that, I didn't think that my husband was here anymore. I thought that he had passed away at that point, and they were just waiting there to tell me.
When he came to us, he went to our cardiac cath lab where he underwent an emergent diagnostic coronary angiogram, where we took photos of his heart arteries. Thankfully, he didn't have any blockages. But after that, he was in the intensive care unit after he was intubated on life support. And we cooled his body to preserve all of his brain function and his metabolic functions.
They do what's referred to as therapeutic hypothermia.
Like literally, you would touch him and he didn't feel, I've felt dead bodies, he didn't feel alive.
Several days later, he got better and he improved and he woke up in a near complete recovery.
Dr. Villalon was somebody that would, the first time that I met him, he came in and he was doing his rounds, and that man pulled up a chair and he sat down, to make, in a way that made me comfortable. He started out with, "Tell me about Ryan." And I was like, "Well, he's a firefighter, this happened on the call." And he said, "No, stop, tell me about Ryan." And I needed that in the moment, and it was, and he was so informative.
When I think of Dr. Villalon, I think of someone being professional, right? Like a true master of their craft, not just from a clinician standpoint, but from bedside manner, right? Like you can be world class, but that doesn't mean you can talk to people. That doesn't mean you can take a wife with 2 kids at home and pregnant, right? And a sick husband under your care and make her feel comforted. Like that's a very difficult task, and that doesn't have anything to do with medicine. That has everything to do with being a human, right? And not everybody's born with that skill set.
For about 2 weeks leading up to arriving at the hospital, I was having some uncomfortableness down my neck and my left shoulder. It was nothing painful. I didn't think anything of it, just kind of like a kink, like you slept wrong or something. One of my friends said, maybe it's COVID, you should go to the hospital, So I went to the hospital. They did several COVID tests. They did a blood test. The first thing they recognized was my troponin level was high. That's a protein in your heart that's not supposed to show up in your blood. I had negative COVID tests, so that meant that it was something to do with my heart. It only took about an hour, and they transferred me by ambulance to Fairfield, NorthBay. They brought me straight to the cath lab. I met Dr. Villalon, and he went over the procedure. He said hopefully it wouldn't be something too serious, maybe a couple stents or something that he could do during that procedure. When I woke up from the cath procedure, I noticed that Dr. Pribble was in the room, and I recognized him because about 1.5 years before, he had done my father's triple bypass surgery.
When we talk about coronary disease, we talk about two factors I think that play the biggest part. Is number one, when your birthday is, and number two, who your parents are. A year earlier, her father came in with a very similar episode, similar blockages in the coronaries of his heart, and we ultimately did heart surgery on him and did bypass surgery, and he did well afterwards. And so it was shocking to see her not as a patient's family member, but now as the patient.
He told me, it's pretty serious. We're not going to wait. We're taking you in right now. So instantly went upstairs into the ICU to be prepped and went straight into surgery for a triple bypass. There was no waiting.
I was a wreck. I saw my daughter laying there and all the tubes coming out. It was heart-wrenching just to see her in that same position that my husband was in a year and a half before.
Flash forward to my surgery 2 years later, that was replaying in my head. What did I do for my dad? How do I get out of this? The ICU room that I was in was the same that my dad was in. And out of all the hospital rooms downstairs, I stayed in the one that he was in. So spiritually, he was with me. I believe that helped me get through it.
The recovery that she had was pretty amazing. I took her home from the hospital and we stopped by the store on the way home. And she went in by herself and she was doing very well. I was shocked.
I feel good. No complications. I got pregnant in late September of 2022. In my situation, it was kind of unique to where I had both husband and wife teams, so that actually kind of made my pregnancy go by faster and easier just because they could talk to each other and not have to wait for some other doctor.
Jessica was lucky that she was able to recover from her cardiac surgery. If she had not had any symptoms or had not had that surgery before coming into pregnancy, she could have had a much more complicated pregnancy, which could include risking the life of herself as well as her baby.
It made a huge impression on me that they really consider not just their patients, but their families as well. They kept me in the loop with everything that was going on and let me know if there was anything that I could do to help as well. It was a joint effort as a team.
I was fortunate enough to be a member of the San Francisco Fire Department, and so they were asking their retirees if we would be willing to take a cancer screening. And a month later, I was told that I had a cancer signal in the pancreas. And they started performing all the different tests that I needed to have, and it was determined in about 6 weeks' time that I did in fact have pancreatic cancer. And so that kind of took my breath away a little bit, because we all know that pancreatic cancer can be very serious.
He developed a pain in his calf, and we didn't think much about it. And about 2 days later, he was having a really difficult time breathing.
And it wasn't anything like I'd ever experienced before. And I checked myself into the ER at my medical provider. They determined over the next 24 hours that I had bilateral pulmonary embolism.
They thought that because of his age and his diagnosis, they would just send him home with blood thinner. And he decided to go home with my son, the paramedic, and started experiencing real breathing difficulties, and ended up at NorthBay Medical, where the miracle happened.
It was my dad. And progressively, as I'm getting these messages, I'm not feeling so well, I'm not breathing too well, I have shortness of breath, I have pain in my chest, Mom is taking me to the hospital. And heck of a thing to hear in that situation.
His son works for a company called NRE. NRE Medical is a company that specializes in making devices for minimally invasive thrombectomies. That word thrombectomy means the removal of a blood clot, specifically in a lung, for the purpose of relieving the blood clots called pulmonary embolisms.
All I knew is that the procedure could last about an hour and a half, and that they would be able to help me breathe a lot better.
The doctor was extremely well trained in this and just the kindest man ever. treated us as, you know, his patients from forever, and took care of the situation and was able to retrieve all these clots from my husband's lungs, an astounding amount of clotting from my husband's lungs, and he could breathe. And he could the next day, well, actually 2 days after this, he was out golfing.
I was a part of a miracle team. I mean, that team in there was so efficient and so professional. I was in the best hands possible, and I knew it. I knew it. And I'm so grateful. And it'll always be the #1 miracle of my life that I was fortunate enough to walk into NorthBay Medical Center with a serious health problem and be treated so professionally. I'm so grateful.
I became a patient many years ago of Dr. Mantrajay's, and he would monitor me constantly, and in particular he was paying attention to the what they call stenosis, which is a buildup of material in your aortic valve. When it narrows to a certain threshold, you start having trouble. Your hands, you can feel it start tingling or becoming numb. You'll have points where you get extremely weak.
His heart wasn't doing well. And he was referring to his, trying to catch his breath.
I was constantly trying to get more breath. And as I said, my hands started tingling or they would go numb.
He was sent to me a few years ago with a heart murmur and some symptoms of fatigue, and very quickly we made the diagnosis of aortic stenosis.
Dr. Mantrajay and Dr. Lasai had decided that he needed a TAVR.
TAVR, T-A-V-R, a trans-aortic valve replacement, which means it's not an open heart surgery.
It really has revolutionized something in cardiology that previously was, a lot of these older people we couldn't do surgery, and all we could do is watch them slowly fade away. And with this new TAVR procedure, we can keep people going with not just extending their lives, but actually maintaining incredibly good quality of life too, which is really very gratifying.
They wheel me up, and they wheel me through the doors. Honest to God, I raised my head up, I looked around, and I just said, wow. This wasn't Star Wars, it was beyond Star Wars. Incredible advanced lighting. You're looking at giant screens with technicians who are monitoring everything that's going with you.
Ted did great. He was our star patient. He came in, the procedure went well, he went home the next day. It was overall a successful case.
So now it's, what are we going to do now that we have life we can count on again, and we have the feelings to be more vibrant again? But what are we going to do with that wonderful time we've been given? It's, dreaming again, setting goals again. We're planning again. All of these things, that would have never been in the cards before the surgery.
It reset us on life, life with 2 kids and a growing family in your 30s with 2 working parents is busy, and we value every single day, and we live each day to the fullest that we can, and we do a lot of things with our extended family. We make as much time as we can to spend that time that we know is really precious and can be taken away in a moment.
I wouldn't have her here if NorthBay hadn't taken such good care of my daughter during the heart surgery. Now I've got a daughter that's still here, and now I've got a granddaughter as well.
Just the fact that NorthBay had a team that could do this rather innovative procedure and do it with such teamwork to save Paul's life happened. And for whatever reason, we're going to take advantage of it for sure.
At community-based hospitals, oftentimes rest on their laurels a little bit, right? They don't really need to advance medicine all that much, and it couldn't be the more opposite here at NorthBay. NorthBay continues to push the envelope in advancing medicines and in increasing new technologies. He's bringing new procedures through the operating room that are being done here. And that's incredibly rewarding.